Hello, everyone. When we ask you to bring in your x-rays when you make your appointment before you come to see us, it's for good reasons. And in this video, I'm going to talk about why we ask you to bring in your x-rays at your first appointment or sometimes before your first appointment. Thank you for joining me. For those of you who don't know me, my name is John Lin. I'm a urologist here at Sunrise Urology in Gilbert, Arizona. For those of you watching this live, feel free to ask any questions in the comments. And if you're watching this on a replay, feel free to leave any comments or questions in the comment section below. This is being streamed to YouTube and Facebook concurrently. Okay, you may be thinking, why is this practice making it so difficult for me to get in to see them? When we make the appointment, they ask me to bring the x-rays, bring the CT scans, the ultrasounds, and sometimes they'll reschedule my appointment when I don't bring the x-rays. Believe me when I tell you, we don't do it just to spite you. We do it for very good reasons. Often, without the imaging studies, I can't make a definitive diagnosis. And you would be wasting a trip to come and see us, wasting a copay, wasting your time, gas, lost revenue to come to see us. And that's why we insist on these x-rays. Let me give you 4 reasons why we give you these x-rays. We recently had a couple of patients and their family members being mad at us because we said, hey, you know what? We asked you to bring those x-rays on your first visit, and yet you didn't bring them. We're going to reschedule your appointment, and they got mad at us. Well, first of all, we inform you before, when you first make the appointment, that you need to bring those x-rays, and yet you didn't bring them. So I'm going to shift the blame back to you a little bit, okay? The reasons we ask you to bring them are, number 1, for instance, if you're coming in to see me for kidney stones, and usually you have gone to the ER has obtained x-rays or CT scans of your belly and said, there you go, there's some stone or stones. This is the reason why you're having pain. Well, what you don't understand or may not understand is that these ER doctors are often simply looking at the report. The report may say you have a stone in a drainage tube called the ureter, and the radiologist will say, yeah, that's the reason why the patient is having pain, and that is the reason why you're being seen at my office, or they refer you to see a urologist. What often doesn't happen is that people are reading the summary, and what often doesn't happen is in the body of the report, there may or may not be mention of stones in the kidney or kidneys. Unless you bring the x-rays for me to evaluate, to look at, that will be missed. Now, imagine if you have your stone in the ureter treated, and a week later, you end up having the stone come down from the kidney, causing the same blockage. You'd be a little pissed, wouldn't you? I know I would be if I were the patient. Often, the summary of the report is read, but the body of the report, there's either no mention or there was mention of kidney stones, but you, the patient, are not informed unless somebody looks at the report. More importantly, look at the images themselves. And that's why we ask you to bring those images, the CD, so that I can look at it. So I can tell you that you truly just have a stone in the ureter and not stones in the kidneys as well. Secondly, when it comes to these images, when you bring the x-ray, the CT scan, for instance, to look for me to evaluate you for kidney stones, I am doing something more often than not. What I'm doing is I'm taking what's called a cursor or a region of interest cursor. I'm putting that over the stone of interest. Depending on the reading that I get on that ROI attenuation reading, I can determine whether or not you are a candidate for a certain types of surgical treatment. Without the images, often some urologists who don't look at the actual images will say, you know what? I'm going to send you for another x-ray to determine whether or not you are a candidate for a particular type of surgery, wasting your time energy, and money. Meaning you have to go somewhere, get the x-ray, come back, make another appointment, come back to have it evaluated before your stone could be properly dispositioned and treated. That's a big waste of your time and energy. And we try not to do that. Believe me, when we turn patients away because they don't bring their images, it's not just a loss to you, it's a loss to us too. We are not seeing you. That means we're not generating revenue, right? So it's a big loss. And also that time slot could have been spent on somebody else with a urologic problem. There's a shortage of urologists, and there's a big wait to get in to see urologists. Believe me, when we tell you that we don't want to cancel your appointment, we don't want to reschedule your appointment, we want to see you efficiently. And that means seeing your x-rays when you make the appointment, when you first come in. That means you have to bring those x-rays as we've instructed you to do so. Okay, second benefit of you bringing the x-rays is that humans are not perfect. I've already mentioned sometimes the stones are actually present on your CT scan are not mentioned in the body of the report. Radiologists are not perfect, and I'm going to give you a case example. There are numerous case examples. I've posted them on my timeline, on my personal Facebook timeline, of mistakes that radiologists have made. And here's one. I'm going to show you some CT images of a patient's CT scan. Now, I told this patient not to go to this particular imaging center because this center locally here has been known in the past to make more mistakes than I care to mention. So I told the patient not to go to this imaging center. Did he or she listen to me? Nope. Went to the imaging center anyway, got a CT scan, and here are the CT scans from many years ago I'm going to show you right now. This is a CT scan of the abdomen and pelvis. You're facing the patient. You're looking at his kidneys. The arrow, the yellow arrow on the left side of the screen indicates there's something abnormal. So notice that one right there. So on a similar CT, on the same patient, same date of service, same scan. Oh my gosh, look at this mass on the left side of the kidney. It turns out to be a cyst or fluid-filled sac. And wait, there's more. Same patient, same CT study. Wow, look at that. More abnormalities in the kidneys on both sides. In addition, there's a stone in the left kidney. Wait, what did the report say? It says everything was normal. It's highlighted in the yellow. Everything looked fine. If I had not looked at the images, if the patient did not bring the actual images for me to download, review, all those things would have been missed. The cyst, the masses in the kidneys, the large stone in the left kidney, it would have been missed. And the patient may end up in the ER, and somebody else will get additional CT or imaging or ultrasound and said, hey, you know what? You got all these renal abnormalities, kidney abnormalities. Did you know about that? And the patient would say, no, because whoever reads the report will say everything looked normal, when in fact there were masses in the kidneys and a good-sized stone in the left kidney, not mentioned in the report. So humans are not perfect. And that's why another set of eyes for me, like for instance, my set of eyes, to look at these images benefits the patient, because radiologists are not perfect, urologists are not perfect. Whenever you can have an extra set of eyes looking at the same study, it benefits you, the patient. And that's another reason why we ask you to bring those images. Just imagine, you are the patient, you brought the images, and I see this abnormality. What I can do is I can literally do a show and tell. I can show you what I'm seeing on these images so you don't have to rely on somebody else telling you what is going on. Most of us want to see the stones or the cyst or the mass in the kidney or mass in the testicle. For instance, I saw a patient recently who had an ultrasound of his testicle, which detected a mass, and that mass was suspicious. I can explain to the patient the location of the mass, what it looks like, there's blood flow going to it, and it's suspicious for cancer. Seeing is believing, seeing the x-rays. And also, I can tell the patient that this is your ultrasound or CT done on a particular date, because often people are getting multiple x-rays. So you're able to for sure know that this is what's going on by knowing this is the correct image from the correct patient done on the correct date that we're discussing. And then we can go forward with your treatment plan because we are working with current correct information. So show and tell to the patient is another advantage. And lastly, when you bring these images in, I store them for a period of time. Often I'm looking at masses and comparing them over time, sometimes years. When patients move about, they may bring images from imaging center number 1, imaging center number 2, imaging center number 3. When I have all these images and I'm following a particular mass, I have the ability to go back in time and compare your imaging from 3 years ago, 2 years ago, and a year ago, all done from separate places. With the ability to look at these images and compare among them, I can tell you this mass is not growing. It appears to be a benign non-cancerous mass versus this is something that we need to worry about and we need to consider doing some sort of surgery. So being able to compare old versus new images is yet another advantage of you bringing the images. And that is why we insist on you bringing in images. One, looking and being able to measure the stone, for instance, that I mentioned, and eliminating your need to get additional imaging before we can treat your stone. And number two, humans are not perfect, and often the report's wrong, and I sometimes can detect that mistake and render the correct diagnosis and treatment to you. Number three, I can do a show and tell. I can show you what is wrong with you internally that you can't feel or see from outside your body. And lastly, being able to compare the old and new images. So those are 4 reasons why we insist that you bring your images on your first visit and subsequent visits. It's not to annoy you. It is not to delay your care, but I want to make sure you are getting the best care. You're not spending extra time, money, travel, wear and tear on your vehicle to come and see me. Often the patients drive far away to see me, from hours away, even though I'm in Gilbert, Arizona. It's a fairly metropolitan type of an area, suburb of Phoenix. People still drive far away from Globe and Prescott Valley and Flagstaff to see me. And when they come to see me, I want to make sure I provide the best care. I want to be able to say, yes, this is normal, or this is not normal, and this is what we need to do. Without the imagings, we will be operating literally in the dark. So we're not here to irritate you when we say we want to see your images and we cancel your appointment when you don't follow our instructions and not bring your images to see us. We believe me, it's a loss for a lot of people, us, you, and also patients who couldn't get in because that appointment is lost because you didn't bring your images. So anyway, I hope that that helps you understand this explanation of why we insist on looking at your images. Those are just some of the points. If you have any questions or comments, as usual, leave them below. Thank you so much for the privilege of your time, and take care of yourself and take care of each other. Bye-bye.